Well, hi everyone. Welcome. We're just popping into your social feed wherever you might be watching from. Uh, and we're going to have a little discussion and Q&A about MDMA for PTSD. Now, buckle up. If you're an average therapist like I am, you might be asking yourself, what is this about psychedelics in psychotherapy? And it might seem so far removed from your average day-to-day life as a therapist that you're wondering, is this really for me? And I'm here to tell you, and I think our guest here today is here to tell you that it's coming, and it's something for all of us therapists to learn at least a little bit about. So I'm Zach Taylor. I'm the director at Psychotherapy Networker. We're a nonprofit, one of the largest nonprofit organizations serving mental health therapists, and one of the oldest and longest running magazines and conferences for psychotherapists around the world. And next week, we'll be doing what will be the largest, as in most widely viewed psychedelic training event, I think, ever in history. So far, over 32,000 therapists have registered to either join us live or watch the replays, which are available for 14 days, again, to any clinician anywhere in the world who would like some free training, free, real postgraduate level training in psychedelic-assisted therapies. We hope you'll join us. There is a link on the bottom of your screen where you can just register literally with your email address. And we do hope you'll join us. CEs are available. We did ask for a very, very nominal upgrade for CEs. But other than that, you are very welcome to join us for the event or to watch the replays. But here we are. We're going to talk to Dr. Ingmar Gorman, who is really one of the pioneers studying MDMA in therapy. He knows about more than anyone I know on this topic. And if you have a question for Ingmar, please go ahead and drop it in the chat wherever you're watching from, whether it's on YouTube or Facebook or LinkedIn. We will get your chat and you can ask him any question you have whatsoever about psychedelics and particularly MDMA for PTSD. So Ingmar, I'm going to throw it to you to kind of set the stage for us and tell us why you're so excited about this and what every therapist should know about the work you're doing.
Great. And thank you so much for having me here. It's an honor to be part of the Psychotherapy Networker. And then also, I'm humbled to be called a pioneer, definitely, standing on the soldier of giants, predecessors who have really contributed to this work long before I have, but I'm happy to be carrying the torch. So I'd love to talk a little bit about some of the basics. I think one thing that an average therapist usually is thinking when they hear the notion about MDMA-assisted therapy or psychedelic therapy is, they may be thinking of this as a replacement for a typical psychopharmacological medicine, so like a take-home. And I want to be really, really clear when we're talking about any psychedelic medicine, including MDMA. This is something that a patient, or in the case of a study, a participant will receive only 3 times over the course of about 4 months. And they're not taking it at home. They're doing it in a clinic or in a research site with 2 therapists. So this is really about psychotherapy. And that's why we call it MDMA-assisted therapy. So it's not just about the drug itself, the MDMA, but it's also about the therapeutic process. And it's really the kind of combination of the psychotherapy and the pharmacological drug that is creating a kind of a combined effect. Mm-hmm. And so that's why it should be really interesting, I think, and that's why many therapists should know about this, because this is about psychotherapy. It's not just about psychopharmacology. I would like to share with you just some high-level findings. So right now, from the studies that have been completed, and we're nearing the conclusion of phase 3, we believe. We'll talk a lot more about what that is in another engagement. But of the participants who've been in these studies, roughly 68% of them no longer meet criteria for PTSD 1 year after the treatment. And these are individuals who have quite severe PTSD, often not just single incident, but complex trauma, where the average number of years that they're living with these PTSD symptoms is roughly about 14 years in the most recent study that was concluded.
Mhm.
Another take home that I really love for you to all consider is that this is not just the suppression of symptoms, but really it seems like a long-lasting treatment. And so a study published in 2013 on MDMA-assisted psychotherapy for PTSD found that at a 45-month follow-up, so you're hearing me correctly, it's on average 4 years later, the range was actually much broader. These benefits are still sustained. And that's really, really important. And I want that to kind of lead into my last point here before we get into some of the Q&A, is that although this treatment has been so important and healing for many of the participants in the study, it's not just a simple erasure of the trauma or the symptoms. It really is a therapeutic process in which the participants in this research are engaged with the trauma and also what has made the trauma so chronic. And that's not always the traumatic event itself. It's all of the person's biography, their life, their relationships that has maybe contributed to the trauma being so sticky. And that means that the therapeutic process itself can sometimes be challenging. It's not all sunshine and rainbows. Often, the majority of the participants do come out, in some ways you could even say cured. But I think what the media misses, and sometimes that even some of the scientific reporting misses, is the complexity of that process, of that therapeutic process from recruitment, from the beginning of participation in the study or treatment, and then to the follow-up. There's a lot that happens, and that's why the therapist's role is so important in supporting the patient or participant through that healing process.
I'm really glad you made those points. Not only you said a 68% sort of successful outcomes, meaning the client no longer meets criteria after a year, but you're emphasizing the psychotherapeutic process. And I remember back in the early 2000s, there was a lot of work around a drug that might, I think Joe Ledoux's work about erasing PTSD, erasing traumatic memories. And that was all the rage.
Mm-hmm.
And I'm worried that psychedelics might be seen the same way, that we're just going to give these, they'll take away the trauma. But your work shows very clearly, this is still a psychotherapy assisted by these pharmacological agents. So that's a great point. That's a great point. Let's jump into some of the questions. The first question is basic, pretty basic. I think every therapist watching probably will want the answer to this question. What do I say right now in 2022 to my client who comes in saying, I want to know about psychedelics. Tell me what I can do. I'm interested in them. I'm curious. What can I do? Or they come in asking, hi, Alex Richmond. I know you. Comes in asking, saying, I'm going to do MDMA with, I have a friend. I'm going to do this with a group outside of a clinic. And you're my therapist. Do you have any advice?
Yeah, great questions. So for the first one, I think the answer is really education and harm reduction, and also doing no harm, which means to not stigmatize the person for having this interest or for wanting to learn more. Education can include really providing information, almost like we do in motivational interviewing, where we provide the person with information so that they can make a choice for themselves. So really supporting their autonomy around their decision making. But the education also involves our knowledge around, roughly where we are in terms of the clinical trials. Not everybody's an expert in MDMA or psychedelic therapy, the latest news, but right now our estimates are that it could be, I have to be very careful about how I phrase this. It's not sure. The studies are not completely done yet, but it could be as early as 2024 that MDMA may become a prescribable medicine, in which case, if the patient is appropriate, there can be a above ground legal way, and I think safe, regulated way for people to have access to this treatment. So that's one side of it. But if they are choosing to have an experience on their own, I think really beginning to explore what their motivations are for such an experience. Some people are looking for healing or addressing some psychiatric ailment, but others are doing it for purposes of self-exploration or enhancement of relationships. We shouldn't remember that prior to MDMA becoming illegal in the mid 1980s, it was used quite prevalently for the treatment, one, of trauma, but also in couples counseling. So there are various motivations that people have, and it's really important that we are able to kind of evaluate those motivations, engage with the patient in a way that's building a therapeutic alliance, but also provide some information about some of the risks that may be there. So we don't want to be overly sort of positive and enthusiastic about it, although there's a lot of potential. And we want to balance that out with some of the real risks that a person could encounter.
Mhm. And I just want to point out, Ingmar is intimately involved with the research, the phase 3 trials that are going on right now. So you have firsthand knowledge. There's a lot of questions. You mentioned that this might be a prescribable medicine, maybe if all goes well by 2024. People are asking in general, any studies on MDMA for 9/11 survivors? They're seeing a lot of the studies are on military veterans. And then also, that was from Susanna. And All Wellness Center asked, what's the status of this being approved for an approved treatment for military or first responders? Would that maybe come earlier?
Potentially, all really great questions. So I believe there's a bipartisan bill where there's going to be dedicated funding for psychedelic psychotherapy research within the VA. And there are already 2 VA studies that have begun looking at MDMA for PTSD. And that may potentially be more accessible. Well, I don't know if it'll be sooner. It's quite complex, the landscape. I mean, just to bring in just another variable here, you may have known that Oregon just legalized psilocybin therapy on a state level. So we're having the politics of this and where things are shifting. Things are moving rapidly, but who will be first and what that will look like, I think that's all just happening live in the moment. 9/11, yes, there have been participants in these studies who one of their traumas was 9/11. Sadly, what we see is that many people with more complex and chronic PTSD have endured multiple traumatic events. And I will be presenting at another point a breakdown of the different types of the identified trauma, right? Because we have to follow criterion A for the participants in these studies, and you can see the breakdown. And it really is a heterogeneous or diverse group in terms of the traumatic events.
Mm-hmm.
So which is of course, we never want people to go through these kinds of deep traumas, but it's helpful to know that it seems like regardless of the etiology or the kind of trauma that a person has, this treatment, again, in the research that we've done so far, is helpful across different kinds of traumatic events.
Mm-hmm. Okay. So Kylie asks, what's your opinion on psychedelic treatment for trauma along with psychiatric medications? Are you noticing any, people come in on SSRIs or SNRIs or antipsychotics? What are you learning about the interaction between psychedelic therapies when they're on these other long-term medications?
Sure. So at first I have to say that I'm a psychologist, not a psychiatrist or an MD. So this is a little bit outside of the scope of my practice. It is outside of the scope of my practice. But of course, being involved in the research, this is data that we have available and it's part of our procedures. So far, individuals on SSRIs and other kinds of medications are titrated off prior to participating in the trial. I would really highly recommend the work of Kellen Thomas. He is a psychopharmacologist who specializes in psychedelics, along with Ben Malcolm, who is a co-author of his and a colleague. They have both published papers on this topic in terms of the interaction between various typically prescribed pharmaceuticals and other psychedelics, including MDMA. So, there are definitely interactions that we need to be careful of, particularly around serotonin syndrome. But there are ways to kind of, how should I say, take that into consideration if a person is on a daily medicine and accommodate that for the treatment.
Awesome. I just want to mention, for those who might be just popping on in the middle of this, that Dr. Ingmar Gorman is the co-founder of Fluence Training. If you want psychedelic training as a clinician, this is the place I highly recommend. It is full of incredible clinicians who are involved in the research. They know what they're doing. And many of the Fluence trainers, along with many others, are going to be involved in our Psychedelics in Therapy Summit next week. It is completely live. We at Psychotherapy Networker felt so strongly about this. We're offering it completely free to any clinician who wants to join. You can sign up just literally with your email at the link. It looks like, Rachel, thank you. Put it at the bottom of the screen. It is true postgraduate level training. CEs are available if you'd like them. And it's an incredible lineup. Go check it out. Dr. Gabor Mate is going to be there with a keynote. Dick Schwartz, the developer of internal family systems therapy, is going to be there. And many of the Fluence trainers and ketamine experts, ayahuasca experts. We're going to have one workshop on pretty much every major agent that's being used right now. So you're going to get a nice buffet. If you're new to this, this is the perfect place to start. And Ingmar and his organization, Fluence Training, is also offering, only for people who sign up, their 2-day foundational program. I don't know if you call it the foundational program, but I call it the foundational program. That is sort of the doorway into becoming a psychedelic-assisted therapist. Only if you sign up for the summit do you get to be part of, to sign up for this cohort that'll happen in August. So the summit is next week, live, and the Fluence training after that, the in-depth foundational training, is in August. So again, Susan, Ingmar is part of Fluence Training, just to repeat that. Okay, back to questions here. This is from Farrell. I hope I'm saying that right. How different is ketamine treatment from MDMA? Just quick comparison there.
Yeah. There's a comment that I saw in the chat that I'd like to maybe take after that.
Please.
Yeah, they're very different. Pharmacologically, they're very different. Without going into I'm trying to not go into too much detail. Maybe at a very high level in terms of the subjective experience is that ketamine is sometimes referred to as a psychedelic dissociative. It is definitely a dissociative drug, meaning that it's dose dependent, but there's some degree while a person is under the influence of ketamine where there's sort of a separation between themselves and their experience. And that can be quite dramatic in terms of a very strong dissociative state. Whereas MDMA does not produce that kind of dissociation between the self and sort of a person's immediate experience. And so their trauma while on the MDMA versus on the ketamine, the psychotherapy process can look quite different, and how people are engaged with their traumatic memories or that trauma-related content is a little bit more, I would say, kind of direct with the MDMA. They're a little bit more in touch with it. However, I know that there are clinicians who work with ketamine and ketamine-assisted psychotherapy where maybe after the acute effect of the ketamine, it begins to resemble a little bit more like an MDMA process where there's sort of a softening of emotional experience, greater capacity for vulnerability acutely after the ketamine, and there can be some kind of processing of trauma that happens. In terms of the research and empirical findings, there haven't been very many published studies on ketamine-assisted psychotherapy for PTSD, although there have been empirical studies looking at more pure just ketamine administration, a ketamine infusion treatment for people who are living with PTSD. And the findings there are also promising. But what I'll say is when I've compared the effect sizes there, the effect sizes are larger in the MDMA treatment, meaning that you see on average more dramatic decreases in PTSD symptoms in the MDMA treatment.
Mm-hmm. You mentioned a comment.
Yeah, I saw somebody say something in the chat that they will always that PTSD will always be, or trauma will always be, part of their life. And I really appreciate that comment,
Yeah.
because I was really struck by a participant. I once spoke to him from one of our studies, and he said that the MDMA-assisted psychotherapy didn't remove the trauma; it changed his relationship to the trauma. And I think that really sums it up really, really nicely. That I think if you ask any participant, they wouldn't say that the trauma is gone from their life. It's that they sort of are able to, in some ways, live with it in a way that no longer is causing the kind of intrusive, difficult problems for a person to live a fulfilling life.
Mm-hmm. We're going to wrap up here just in just a few minutes. I know there's a lot of questions out there. If you have more questions, this is a great segue to just mention again, Ingmar is going to be with us next week, next Wednesday and Thursday, totally live, along with 9 other psychedelic experts, providing workshops on ayahuasca, ketamine, MDMA, psilocybin, harm reduction, integration after psychedelic experiences. You're going to get a buffet of training over 2 days. It's a real live postgraduate level training, and CEs are available. If you'd like to attend, it is free to attend. You can sign up. Thank you, Rachel, again for putting the banner up. Brock Fowler asked, have there been significant changes in research and or negative side effects where some individuals have taken ecstasy, which is also MDMA, as intended recreational drug, and then have experienced treatment-resistant depression or psychotic states? So I'm guessing after effects using this on their own and experiencing long-term negative effects.
Yeah, so it's complicated. So one, ecstasy or any kind of, that's right, the term for MDMA that is available on the black market. The one thing to say is that it's very rarely pure MDMA. Most often it's adulterated with something, at the very least, some sort of agent that helps it stick together as a pill if it's in pill form. But most often it has other kinds of psychoactive components to it. But if we assumed it was pure MDMA, well, the research that we see on individuals who are using black market MDMA outside of a clinical research setting, there is research that shows that there can be long-term negative side effects of that. So this is not to say that that is, well, again, these are people who are using MDMA repeatedly, chronically over a long period of time. And again, not even being clear that it is MDMA, but it could be something else. And they're often doing it in contexts where there's a lot of heat, not hydrating, all sorts of other variables. What I can say is that from the clinical research that we have done for this treatment for PTSD, there have been studies using the R bands, a measure of cognitive functioning, and other kinds of measures to look at what side effects are there. And we don't see any kind of cognitive decline. We don't see any kind of psychotic outbreak. I would say that if a person has a predisposition to schizophrenia or psychosis, that would probably be a contraindication for a psychedelic treatment. Again, it's a little bit understudied, but from the safety perspective, that is something that we take very seriously. In terms of other side effects, they're often biological. So one of the big one is uncontrolled hypertension, because MDMA is an amphetamine. It does increase heart rate. So if somebody has uncontrolled hypertension, that would be a contraindication. But if they get on medication, they get that under control, they can then engage in the MDMA treatment. To me, that is one of the more significant risks.
I think it's really important to go back to what you said very early in our discussion, that in MDMA-assisted psychotherapy, they might only receive MDMA, you said, up to
3 times.
3 times, whereas many people using it recreationally will be using it under the circumstances that you mentioned, daily or under heat or adulterated. So very good point. There's a lot to discuss. So much more for us therapists to learn about psychedelics. It's here in terms of ketamine clinics are popping up everywhere. Psilocybin, as Ingmar mentioned, is legal in Oregon. People are getting certified there to administer it and work with clients. And MDMA, Ingmar said that if all goes well, we don't know, maybe by 2024, MDMA, which is the one I'm most excited about in terms of the data, might be a prescribable drug. So this is coming. And even though it's not completely legal yet, our clients are coming in asking, they're curious, they're using these agents. We as therapists, the more we know, the more we can help keep them safe, engage in harm reduction, and work with them after these experiences, should they have them. So thank you everyone for joining us. Thank you, Rachel, again. If you want to know more, Psychotherapy Networker is sponsoring what will be the largest, as in most widely viewed psychedelic therapy training, I believe, in history. And many of the trainers that Ingmar has at Fluence Training will be there, along with Gabor Mate, Dick Schwartz, Phil Wolfson, many others will be there. Go ahead and check it out if you'd like. Just sign up with your email, and it will be live, completely live. It's not one of those summits where you watch a bunch of videos like for 10 days, and it's 85 hours of content. Everything is streamlined. This is real training, 1-hour sessions on all kinds of different topics around this that I think are really practical to the everyday therapist. So thank you all so much for being here. Sorry we didn't get to every question. But this was just a taste of what you'll get maybe next week. So thank you so much, Ingmar, and everyone else. Thank you so much from Psychotherapy Networker. Hope to see you soon.